Welcome to The Explainer. Today, we're diving into something that is just absolutely vital and honestly pretty eye-opening. We're looking at the psychosocial development and care of the hospitalized child. You see, kids aren't just mini adults, right? While it's super easy to view a hospital stay purely in medical terms, just fixing what's physically broken, a child's developing brain actually processes trauma entirely differently depending on exactly how old they are. It's a really fascinating look at how the human mind grows and copes with stress.
We've got 4 main stops on our agenda today. First up, infants and toddlers. Then we'll look at the preschoolers' perspective, move on to school-age children, and finally, we'll wrap up with the hospitalized adolescent. Think of this whole thing as a psychological growth chart for understanding patient care.
Now, I really want you to put yourself in their shoes for a second. Just imagine looking up at those massive, blinding surgical lights and giant, unfamiliar tools. A hospital is a daunting place full of bizarre rituals. And if it's scary for us as adults, imagine just how terrifying it is for a kid. Think about the weird smells, the sheer number of strangers poking and prodding you literally around the clock. It's an overwhelming, totally alien environment. And for a developing brain, the emotional stakes are just incredibly high.
Okay, so let's dive right into Section 1, Infants and Toddlers, focusing on separation anxiety and loss of control.
When our youngest patients face separation anxiety, they generally go through a crucial 3-step psychological descent if we don't intervene. Step 1 is protest. You know this one. It's the loud, aggressive part. Crying, screaming, physically fighting, kicking. They're actively rejecting strangers. But if that fails and the parent doesn't return, they sink into Step 2, which is despair. They become withdrawn, depressed, and get this, they might even lose newly learned skills like walking or talking. Finally, if the separation drags on, they hit Step 3, detachment. Now, this looks like a superficial adjustment where they start playing with objects and seem to be making friends again.
But here's the massive trap for caregivers. As our source material brilliantly points out, this behavior is a form of resignation and is not a sign of contentment. Detachment might look like the toddler has successfully adjusted, but they absolutely haven't. They're actually just building emotional walls to escape the profound pain of missing their parent. It's actually the most serious phase, because the emotional damage is really hard to reverse once it sets in.
And to make matters worse, the hospital environment totally strips them of their autonomy. Hospitalization severely disrupts a toddler's life, leading to a massive loss of control over feeding, toileting, playing, and going to bed. Let's be real for a second. Toddlers are basically tiny dictators, right? They absolutely hate losing control because they rely so heavily on familiar rituals to feel safe. Taking away that autonomy triggers intense regressive behaviors. They might just revert to earlier stages of development just to cope with the sheer stress of it all.
So, how do we give them back their power? Well, we have to get really proactive with our interventions. Provide cuddling and touch. For infants, sucking or oral stimulation, like pacifiers, is vital, especially if they aren't allowed to eat. We also need to provide choices for control. Even if it's just picking which sticker to wear, it matters. Allow them to express their protest safely. Utilize play therapy, and allow mobility and safe physical acting out. Basically, anticipate the tantrums and create a physically safe space for them to let that frustration out. It's fascinating to notice how their reactions mature as they grow. A toddler's protest is direct. It's physical fighting, kicking, and biting. But a preschooler's protest, it's way less direct. Instead of kicking the nurse, they're displacing those feelings onto others. Maybe they take it out on a patched-up teddy bear or some innocent bystander. And this behavioral shift is actually the perfect segue into our next developmental group.
That brings us to Section 2, the preschooler's perspective, a stage heavily defined by magical thinking and misunderstanding.
Now here's where things get truly heartbreaking. Preschoolers engage in egocentric and magical thinking. This means viewing all experiences from an entirely self-referenced perspective, often believing illness is a result of something they did or thought. Because they're so egocentric, they literally blame themselves for being sick. They might genuinely sit there and think, I hit my brother last week, and now I'm in the hospital. This is my punishment. It's a massive realization that should completely change how we handle their distress.
On top of that magical guilt, preschoolers completely lack an understanding of body integrity. They desperately fear mutilation and often imagine invasive procedures to be way worse than reality. To them, medical tools look like literal weapons. A super simple procedure, like a quick blood draw or getting a tiny band-aid, might feel like a massive threat where they're going to lose their whole arm.
So what are the best interventions for preschoolers? We've got to actively acknowledge those fears and anxieties. Don't just brush off the imaginary monsters. Explain procedures simply, right on their level. Avoid intrusive procedures whenever possible, and absolutely encourage rooming in for the parents. Oh, and here's a surprisingly simple but vital one. Allow the wearing of underpants. For a kid terrified of mutilation, keeping their underpants on acts as a literal physical shield that protects their fragile sense of self. It's a small thing, but it's huge for them.
As they continue to grow, those internal, imaginary fears shift entirely. A preschooler's fear of mutilation and magical guilt gives way to a new set of anxieties. A school-age child starts worrying about missing school, their friends forgetting them, and they develop a very real fear of the illness itself. We're shifting from this internal imaginary world straight into external, highly social realities.
Which brings us to Section 3, School-Age Children, focusing on independence and social awareness.
Now, while kids at this age usually don't go through those 3 intense stages of toddler separation anxiety, they definitely have profound, specific fears. Suddenly, they feel totally trapped. School-age children fear bodily injury, intrusive genital procedures, disability, and feeling helpless if physical limitations occur. Because they're so used to doing things for themselves at home, their absolute biggest fear is losing that independence and feeling utterly dependent on strangers. Plus, they are highly uncomfortable with any type of sexual examination.
So our interventions for school-age children have to strictly target their autonomy. Focus on their abilities and needs. You can ditch the baby talk, explain procedures using actual body diagrams. Make sure you provide privacy and really involve them in their own care so they aren't just passive subjects. And above all, keep them connected. Encourage contacting friends and provide for their educational needs so they don't feel totally disconnected from their normal everyday lives.
Now, I want you to ask yourself a really fascinating question as we move into our final developmental stage. Do teens want their parents with them in the hospital? You'd probably think the answer is an obvious no, because teenagers are constantly pushing for independence, right? But according to our source material, adolescents themselves aren't even sure. They are caught in this crazy developmental tug-of-war.
And that introduces Section 4 perfectly, the hospitalized adolescent and the internal battle.
See, teenagers project this massive outward facade, giving the distinct impression they're not afraid and stubbornly rejecting help to look tough. But the internal reality? They are absolutely terrified. They're desperately seeking help but are unable to accept it easily. It's because of this overwhelming need to appear independent, normal, and fearless. It's just a constant, exhausting internal battle for them.
And let's definitely not forget the absolute power of the peer group. Separation from friends is a massive source of anxiety. Adolescents fear being different from their peers and worry their friends will go on with their lives without them. Think about it. For a teenager, the sheer terror of being socially excluded or forgotten can honestly feel vastly more threatening than the physical illness itself.
So how on earth do we navigate this minefield? Well, here are some adolescent care considerations. First, expect anger, withdrawal, and uncooperativeness. It's just their way of dealing with lost control. Second, respect they are guarded about sexual development. Protect their privacy fiercely. And crucially, encourage questions about appearance and effects. A teen might be way more worried about a scar, weight gain, or hair loss than the actual medical outcome. We have to create a safe, judgment-free space for them to express those incredibly valid fears.
So, as we wrap this up, here is the ultimate takeaway. Treating the illness is not enough. We must adapt our care to treat the specific developmental and emotional needs of the child at every stage. We've seen how a toddler's desperate need for routine is wildly different from a preschooler's magical thinking, which is entirely different from a teenager's fear of missing out. Truly effective medical care, it requires treating the mind right alongside the physical body. And I want to leave you with this final provocative thought. If we successfully cure a child's body but ignore their developmental trauma, have we truly healed them? The psychosocial care of a child isn't just an optional extra. It is the absolute core of healing. Thank you so much for joining me on this explainer. I really hope this helps you completely rethink pediatric care. Keep learning, and we'll see you next time.